Hello, I'm Gavin Giovannoni. I'm a professor of neurology and I'm based at Barts in the London School of Medicine and Dentistry, and I'm working in the East End of London in the United Kingdom. So I'm an academic neurologist. I spend most of my time doing research and thinking about multiple sclerosis, and I'm very involved in developing disease-modifying treatments to try and modify the course of multiple sclerosis. The problem about these therapies is they are very high cost therapies, and that prevents people accessing them. And one way would be to go the normal regulatory route and try and get the pharmaceutical companies that market and manufacture these therapies to make them available throughout the world. That very rarely brings the price down of the drug. The other thing is to use political solutions, and so one way is to try and get the World Health Organization to put some of these treatments on the essential medicine list. Issues we've also got to counteract that MS is only a disease of the so-called rich world. We know that multiple sclerosis is more common in Western Europe and North America, but we're beginning to see an increasing number of people being diagnosed and presenting with the disease in other regions of the world, particularly in North Africa, Middle East, Asia, China, South America. And so the burden of this disease is increasing globally. And so one of the problems we need to do is counteract this dogma that it's a rich world disease. And so 5 years ago I went on sabbatical for 6 months, and I traveled all over the world, to India, Australia, South America, Africa, and I was horrified that, for example, in India, that only 2% of people with multiple sclerosis are on a disease-modifying treatment, which means the majority of people aren't accessing the therapy. And the worrying thing about that is the size of India's population means that there are more people with the disease in India than there are in the UK. And it's tragic to see examples of how difficult it is for people to access treatment. Similarly, when I was in South Africa, there's a dual healthcare system there. There's the private sector where people are privately insured, and those insurance companies make therapies available to people with multiple sclerosis. But in the state system, nobody with MS can afford treatments. So all the people in the state system were not on disease-modifying treatments. So there's an example of a relatively wealthy country with two-tiered system with no access to treatment. And another example is I received several emails from people in the United States of America. These are unemployed people, uninsured, who for various reasons have difficulty accessing disease-modifying treatment. And so it doesn't matter what country you live in, there are people with multiple sclerosis who need to be on treatments and not on therapy. So the access to therapies is not, it's not a one country problem. This is a global issue, and we do need the whole community to get behind this campaign. It's high income countries that have access to treatments need to use their political oomph power to at least nudge the lower middle income countries to take MS seriously. This is a disease that is very disabling. It affects young people in the prime of their life, usually causes them to become unemployed, and maybe one of their partners or family member to become unemployed to look after them. So the economic costs of this disease at a personal family level are enormous. And by the whole community coming together, we could hopefully create the political momentum to get the WHO, first of all, to recognize that MS is now a global problem, and get the disease-modifying therapies on the essential medicine list, and hopefully that will act as a catalyst to stimulate healthcare systems to make available these therapies for people living in their countries with multiple sclerosis.